Hi, and thanks to Kathleen Wayland of Wayland Financial for sponsoring this weekly project. Step by step, Starved Rock Country's healthcare prospects have improved since the dark days when this area suffered the closure of 2 hospitals in rapid fire. OSF, of course, was the first into the void, while most medical professionals went with OSF as a way to practice locally again. A couple of very popular physicians went with Carle Health, which is based in Urbana. It's mostly a central Illinois provider. And since joining Carle more than a year ago, Doctors Thaw Tun and Cote have been practicing downriver at Carle facilities in Chillicothe and Lakin, which has meant a lot of driving for physician, staff, and patient for more than a year now. This week they cut the ribbon on a clinic in Spring Valley that was used for a while by Dr. Tun before the switch, but it's a symbolic new start and a happy return home, so the ribbon was appropriate. Here's what it looked like at the open house at the clinic in the north end of Greenwood in Spring Valley. Notice the happiness in the room.
I don't remember exactly what it was, but I came here with some of my colleagues from Carle Health over a year ago, I think, and met with some of the physicians, and that's when I first got to know Dr. Tun and Dr. Cote. And we are just honored as Carle Health to be able to open a practice here in this community with these 2 outstanding physicians. Woo! Carle's mission is to be your trusted partner in all healthcare decisions. And I know both these 2 physicians, their patients, their staff, put their trust in us to become part of this team and have been very patient. So we could be ready to open up here. And so we're grateful for that patience, grateful that you trusted us to be part of our team, and really happy to be here. I'm a family physician by background, and I grew up in Eureka. I was just looking up some stats before I came up here. Eureka's got a population of 5,100 people. In Spring Valley, I saw 5,600 people. You're on a river, we're on a lake, and we have a small hospital and a practice. And I remember all the patients that I cared for. I was there for 7 years before I went back to Peoria, and how much people wanted to get care in their own community. And we're starting here with primary care practice, and I know that's not every piece of care, but it's a really important piece of care, and really happy to be able to provide that care closer to home for all of you.
I want to thank everyone for the patience. I want to call out some of the operational leaders briefly who have done a great job in getting us to this point. Larissa Bartow, thank you very much. Marcellus Austin, Sonia Stelter. We've had some people who have been really in the middle of this from day one, really working hard to make this happen. But more importantly, I want to thank our patients, who are aptly named because they've been very patient with us. And it's just a coincidence, but that is an appropriate term. Thank you all for hanging in there. We have received a lot of comments and phone calls and so forth over the past number of months, and we certainly have been with you all along. It wasn't a matter of if, it was just a matter of when. We're thrilled to get to this point. We are really happy that we're able to bring some outstanding healthcare back to the Illinois Valley here in the guise of Doctors Tun and Cote, who are some of the most beloved physicians around, as I keep hearing, and I have no doubt why.
So as a physician, it is my goal to ensure our patients are met with compassion and the highest quality of care in every step of their healthcare journey. So communication and reliability are very important to us and to our team. And we understand the added difficulty that our patients have had to endure over the past year and the extra distance they have needed to travel to receive crucial care. And it's an issue for so many families faced as we see less and less rural healthcare providers in the hospitals. And we know that, of course, our 2 hospitals closed in the last couple of years. And on top of that, St. Mary's Hospital and the hospital in Galesburg. So I think in the last 15 years, about 200 rural healthcares have closed. And my understanding is that about maybe 30% of all the rural healthcare hospitals are in danger of closing. So thank you again for your trust. We have worked towards opening these wonderful new facilities, both in Bureau and Marshall County. And we look forward to serving in the community and you. Thank you.
Cut it! Cut it!
The man in charge. So tell us
All
what
right.
we're looking at here.
So here will be where a couple of our nurses sit. These are Dr. Tun's nurses. And then we have a checkout station here. So actually we will have a checkout on both sides. So this is the other side of the front desk. So we'll have two front desks that actually check people in. And then when the visit's complete, you'll have the two checkout desks. And then we have a station here and a station here for our two CMAs, who are the staff that get you ready to see your provider. So this is the other part of the lab where the draw station will happen. So any labs that are drawn in the clinic will happen here.
Patients don't necessarily have to go somewhere else.
Correct.
To get lab work done then.
Yep, and then our courier will come once a day, take it back to Methodist for testing, and then it'll be integrated in our EMR. Provider will get the results.
Well, first and foremost, I came up here right after St. Margaret's announced that they were closing and really tried to understand what the situation looked like. You know, we know OSF had already purchased or acquired a number of those practices, but we had an opportunity to meet with some of the physicians, and Doctors Tun and Cote were just really the ones that we felt would be great additions to the Carle family. And you know, they were persistent, we were persistent in bringing this together, and finally we're able to get them back up here in their home, back to having their patients, having the care that they need in their neighborhoods without having to drive.
Your remarks inside certainly reflected an understanding that the people around here have been waiting for this day.
I made the comment that I did hear comments. You know, we have the ability within the system, we send surveys to our patients and they can score different things, but they also can make comments to us, which are priceless. That gives us great feedback, and there were many, many comments about the need and desire to bring them back to the Illinois Valley, and we're just thrilled to be able to do that.
So that's from a resident's perspective here, but tell me from a corporate perspective, is this the leading edge of the vanguard, or is this the first foray into Northern Illinois, or the leading edge here in Northern Illinois for you guys?
Yeah, we were kind of joking with earlier today with Doctors Tun and Cote about them, you know, being the northern outpost for Carle Health. You know, what that leads to in the future, we don't know. We like the area here. We think there's a lot of potential, a lot of opportunities, and this is a good way for us to have our toe in the water, understand really what it's about, what the volumes look like, what the quality looks like, and so we're going to wait and see. You know, it's certainly not a decision I would make in terms of the overall strategy, but it would be a collective decision about where we go from here. And at this point, we're just thrilled to be where we are.
Can you illustrate for me how this fits into the bigger Carle picture?
Carle's broken into different regions. We are the west region of Carle, and so Spring Valley is part and parcel of the west region of Carle Health, and so this is, again, it's kind of our northernmost clinic. How it will ultimately evolve and develop over time remains to be seen, but at this point it's a standalone clinic, and we would hope in the near future, to be able to bring some specialists in here as well. And so we're excited about that opportunity. We're looking at it. It's not a terribly big clinic, doesn't have a great deal of space, but it's also important to note that we will be opening our Henry Clinic in 3 weeks. And so that Dr. Tun will be spending some time there as well, which creates space for specialists to come here and see patients as well.
What is the nearest Carle hospital to us?
Yeah, it's Proctor Hospital in Peoria.
In Peoria. Okay, so do you foresee a day when there would be a hospital up here?
I don't, not any time in the near future. You know, we looked at the whole St. Margaret situation. It just wasn't something that made sense for any of us. So at this point, that's not on the table.
You shot straight anyway. Would you consider expanding into Ottawa, Carle? Thanks to you, Kathleen Whalen of Whalen Financial, for your support for this project, and I'll talk to you in the morning.